everybody. Thank you so much for joining us for this next episode of Spilling Secrets from the Spa at Aestique. We're going to be talking about bad hair day. We're going to go into all the newest treatments for hair loss. So are you someone who's noticing your hairline changing? Do you suffer from maybe having some balding spots and trying to cover them has become more difficult? Finding hair in your brush is normal. We all shed. But losing an unusual amount of hair can be cause for concern. What if we told you that we have a solution? Let's get to the root of things. So today's purpose, we're going to be talking about PRP Hair Restoration. We'll hit the main points and talk about hair facts, the most common triggers for hair loss, what really is PRP, and what can be done to improve your hair. Joining me today is certified nurse practitioner Marianne Woody. Marianne comes to Aestique with a whole background of knowledge. She's been in the industry for about 30 years, and she does aesthetic treatments such as Botox, dermal fillers, lasers, and we're going to be talking about PRP today. So we want to welcome you, Marianne, and I'm going to kick it over to you.
Hey, hi. Thank you very much for joining this presentation, and welcome to my home as we do this. I wanted to start with the normal growth of hair because I think it's so interesting, the cycle of hair, that hair starts in a growth phase called anagen that you see at the very top of this slide. So in this growth phase, it lasts about 2 to 6 years that hair could be in that phase of active growing. And that kind of explains why some people are able to grow their hair at longer lengths than others. And 99 to 95% of the hair is in the active growth phase at any one time. The hair then will go into catagen, or a transition phase, where the hair bulb detaches from the blood supply, which nourishes the follicle. And that stage is very short. It's a matter of weeks of that stage before it moves to telogen. Telogen is the resting hair phase that happens, and that phase, about 5 to 10% of the hair is telogen at any one time, where it detaches and sheds and falls out. But you have to think about that. Even though 10% of the hair is shed, then there is that part of hair that is already starting to move into the anagen phase, and that just continues. One more interesting fact about that is that while the hair on the scalp grows 2 to 6 years in anagen, there's different hair cycles for hair on the body. Like, for example, the eyebrows. The hair growth is very short, 1 to 6 months before it falls out. So that can explain why our brows don't get as long as what's on our scalp. So very, very interesting about it. Very interesting about hair.
That is very interesting. And I have a question for you. Is it true that on any given day, we normally shed between 50 and 100 hairs a day?
That's absolutely true, that we shed 50 to 100 hairs, but it could be possibly twice that amount of hair shedding if the hair is not shampooed every day. So it could be on the days of hair shampooing, it could be twice. So that makes it scary for those people that don't wash their hair as often. They think they're shedding more than they should be. So let's start off about the most common type of hair loss that there is, and it's male pattern hair loss. And that's more common because the majority of this pattern hair loss occur in men. About 60% of men experience this problem, although 85% of men are concerned about their hair, because I think it's so common that we see men with hair thinning. So it's really problematic. Men can see this hair loss before the age of 21, and I have seen a lot of young 18, 19-year-olds can start to see that they're losing hair. So it's a real problem. Usually the typical male will have some pattern hair loss by about 50% of men by the age of 40. So if I researched actors and celebrities with hair loss, you can see a lot. Like there's Ben Affleck already starting to have his hair loss. And of course, the royal family, you see a dramatic hair loss pattern in them that's somewhat socially acceptable more in men than in women, I would think.
And looking at the royal family, is there something with genetics? Because I see that all three of them have it. So is this a genetic thing?
It definitely has a genetic component to it. So when I evaluate patients for male pattern hair loss, I ask, is there a father? Is there an uncle? Is there someone that has a typical pattern that you're beginning? So what are the patterns, levels of baldness? There is actually a scale for it called a Norwood scale, where we have either on the left, the front, just frontal recession, and then or is there more in the middle, baldness at the vertex, or is the individual having more serious hair loss near total baldness that can be a pattern in certain families and individuals.
Marianne, if somebody is totally bald, would they be someone that could potentially benefit from PRP hair restoration, or is their hair follicle not able to be?
In the male pattern hair loss, if the hair follicle miniaturizes to the point where you just have some peach fuzz, it's possible. But if I examine the hair scalp and there's no follicle present, as I'm able to do with a special light, if they're shiny bald, no follicle, then PRP would not be the appropriate treatment. It would be more hair transplant.
That's good information. And now let's check out women and hair loss.
So women, it's not socially acceptable to have hair loss in women. So when I see women, it's really their number one cosmetic concern, and they are very anxious that they're losing hair. And when I was researching different celebrities, it's almost hard to find celebrities admitting to female pattern hair loss. But you see here, there's Fergie that is having some type of hair loss beginning young. And 40% of hair loss sufferers are female. By the time of menopause, at least half of women will be dealing with some degree of pattern hair loss. And when we see this kind of pattern in female, it begins with a widening of the central part. So Fergie in that example was really probably a stage 2 of this Sinclair scale. And you see the different worsenings of stages and balding at the top vertex of the scalp. There is also medical issues that accelerate hair loss. Hair loss can be associated with underlying endocrine disorders, whether hypo or hyperthyroidism. It's also like PCOS is another problem. It could be a scalp condition making the hair lose hair, like seborrhea dermatitis is a chronic inflammation of the scalp. Then the scalp can shed hair more often because of that, and because of the itching and trauma to the scalp with the condition. Diet and nutrition play a big role, particularly anemia, in losing hair and the quality of hair, and or there's different autoimmune problems. For example, alopecia areata is interesting. While you see shiny, bald, complete loss of hair in a circular pattern, it could occur anywhere in the scalp. In this condition, the hair follicle still is there to be stimulated. And we can either stimulate it with injections of steroids or PRP. Whatever the condition is, it's a huge psychological impact that happens when people are losing their hair. So there's new research or new science that proves inflammation, oxidative stress, and dysregulated signaling are the root of hair loss. So let's just talk about those causes, for example. While we know that natural aging has a factor of less growth time, that you don't grow hair for as long, there's other damages, stresses to the hair. For example, ultraviolet exposure not only affects the skin, but affects the hair. There are styling products and styling ways that definitely cause effects of inflammation on the hair itself, including pollution affects the hair growth. Talking about the stress, as we are in this time, the stress causes increased cortisone levels that do affect the blood supply to the hair bulb, narrowing its blood supply and causing more hair loss. We mentioned already anemia as a cause, so diet definitely and nutrition play a factor. And there we talked about family hereditary stressors, but that kind of has a factor of the person's genes. There's different genes, such as the dihydrotestosterone, that do play a factor.
Another question, Marianne, just looking at the styling tools, what about women that pull their hair up a lot or wear their hair on the top of their head, or a tighter ponytail or braid?
Definitely a tighter pony, it depends on the traction of what they're doing. The tighter that a weave is or a ponytail is can trigger the hair to go into the telogen phase and be shed. Styling definitely has a factor in the products that you're using in the hair. Cause split ends. The cuticle is like a dead protein that is damaged by brushing, chemical treatments. Traction, though, definitely has a condition called traction alopecia, a cause for hair loss.
And we have a question that just came in from one of our attendees, and she's asking, are iron supplements good, or collagen supplements? She takes them, but it isn't doing anything for her. And she heard that there are some pills that men take for hair loss that possibly women could take that could help.
The pills that she's talking about, what men take, that is finasteride, and that is blocking the conversion, attacking the DHT, dihydrotestosterone, by blocking an enzyme that's converting regular testosterone to dihydrotestosterone. You have to be very careful with those pills in women. You never give them to a woman of childbearing age. It depends on an individual case if they're effective for women. If a woman has features of excess testosterone, like hair on her chin, for example, hair on the belly, some masculine kind of features and she's over menopause, then perhaps it could be helpful if we suspect she has excess testosterone. As far as iron pills, absolutely. Iron, is essential for if someone's anemic to take iron supplements. Just be careful of the usual things like constipation, nausea, in taking those supplements. And then she asked about one more thing. Remind me?
Collagen supplements.
Collagen supplements. Collagen supplements are very controversial, whether they could be helpful or not. They don't have as much research behind it. And I think when I talk about some nutraceutical supplements in this slide, I think it's important to look at the research.
Well, thank you so much for the question.
So what is PRP? PRP stands for platelet-rich plasma, and we've used platelet-rich plasma since the 1970s. It began initially in orthopedics and sports medicine as far as its use, and other specialties, as you see, have used it since that time. We started using it in dermatology for wound healing and the power of PRP. And we've just recently started using it for cosmetic or aesthetic purposes. So it's relatively new. It's one of the hottest things that if you research PRP, there's an explosion of articles about its use and for aesthetics. So what PRP it's really part of the human stem cells that we're using PRP. If we spin down the blood, you see that the red blood cells go to the bottom and our plasma is at the top. The platelets are just about above this buffy coat that are there. Platelets are made in your bone marrow along with white and red blood cells, and that's how we find the platelets. We spin the blood down in a centrifuge and then take that platelet-rich plasma on that buffy coat and use it for a variety of purposes in aesthetics as well as medicine.
And you might have heard the term liquid gold. That's what people call it. And you'll see right there, that's how it's coined its name.
The plasma is a goldish kind of color, and you're exactly right. So just to extrapolate, the adult stem cells come from the bone marrow and fat. That's how we have stem cells. And stem cells generate all kind of other cells for all our whole body. The stem cell can differentiate into many other cells in addition to what's in the bone marrow being platelets, white blood cells, and red blood cells. So I think of PRP as bioactive cocktail. It's the proteins, immune system messengers, and enzymes such as like histamine, serotonin. It has growth factors. It requires like a deep understanding of pathophysiology to understand all of the 800 bioactive molecules secreted by platelets. But in a sense, let me break it down simple. Platelets are stimulated anytime there's a need of a wound. They stimulate a fibrin pot to occur and a cascade of events to repair damage. So that, in a sense, is what PRP is. So what do we do with PRP? PRP has aesthetic applications, for example, with microneedling to stimulate collagen. We use it for wound healing, and wound healing can be from like scars with microneedling, or it could be with even a medical application of pressure ulcers with PRP. We definitely use it with fat transfer, because remember, those are those stem cells that occur. PRP, how we use it, for hair restoration, we do spin down that liquid gold, and we do it by injections in the scalp, as you see in this picture.
You mentioned earlier, we were talking about eyebrows and how eyebrows don't quite grow just like hair does. Can you do anything with PRP on the eyebrows?
Oh, thank you for bringing that point up. I have injected PRP in brows because it's very common, particularly in women, to lose the lateral tail of the brow, and PRP really works great, and I've seen really easily noticed by a female of the growth pickup of the brow. Also thinning, I've used it for as PRP like a filler to stimulate collagen in the skin by injecting it, or even in men's beard to thicken their beard. Has many applications.
That is so amazing. And I just want to draw everyone's attention to the picture on the bottom of the fat transfer patient who did have stem cells. And if you missed our webinar we had on Tuesday, it was Wave That Magic Wand, all about fat transfers. Please go to our YouTube channel and check it out, because the results are amazing. And the glow that you get even from these stem cells and PRP, you can see the proofs in the picture. So I just wanted to bring that up if anybody had missed that on Tuesday.
So I wanted to point out that there is PRP And male pattern hair loss, also referred to androgenic alopecia, is another name for it. There's many studies that have shown a benefit of PRP to increase hair number density, to make new hair, and to make that hair shaft thicker, because normally in a follicle what happens is miniaturization of the follicle. Normally the follicle has 2 or 3 hairs jutting from it, and when we look at androgenic alopecia, we actually can see there's only a thin little hair. There's still hair there that could be stimulated. Here we see on the left a baseline picture at the end of a third treatment, a clinical improvement that was done in this study.
On something like this with this study, how long would you expect it to take to be able to see a result?
Well, you really have to wake up and the dormant hair and start a repair process of building new blood vessels. Most people about a month after their third treatment. Sometimes the younger the man is, and I've noticed because I've treated more younger men, the younger that they are, it might even be after 1 or 2 treatments.
Is that the same for women?
Women respond as well, but the most response is about a month after, a measurable result after the third treatment, in both men and women. I'm just saying that men can, the younger they are, the more dramatic results happen more quicker. So what is the process of PRP? It's a blood draw. It's easy. It's like going to a Quest or LabCorp lab that we're drawing blood from the individual and obtaining the PRP. We're spinning it down, as you saw in the centrifuge, and then we do little injections in a grid-like pattern about 1 centimeter apart in the area that's affected. So we concentrate the PRP in the area of the scalp that needs it, or the eyebrows, or the beard, for hair restoration. As you know, then topically we give it when we're doing for skin rejuvenation. Can be applied topically or could be used like a filler. So the frequency for hair restorations, we usually give it monthly for about 3 to 4 months, and that we do 3 to 4 treatments. It's important to know that most people need a maintenance treatment. In fact, everybody does. 1 treatment about every 6 months thereafter is needed, because if you're not constantly stimulating the hair, it's going to revert back to the original condition. So let's just talk about any restrictions. We do not consider it to be a good candidate to treat anybody that has an active or chronic infection, such as active seborrheic dermatitis. We wouldn't want somebody to treat them at that time until they were controlled, or have any type of anemia. We're taking blood from them, and we don't want to reduce and cause worsening anemia. Because it is an injection, we wouldn't want to treat anybody that has a bleeding disorder and have trouble with blood clotting, or treat anybody that has any current cancer treatment. So people probably wonder, what's the side effects of this treatment? It is drawing blood with a needle. I had one young person that was needle adverse and never had his blood drawn, interestingly, and was quite nervous about it. So we had to put some topical numbing on the area of the arm. But most people get their blood drawn without any special care, and get their blood drawn easily. They have, it's really minimal scalp discomfort during and after. During, we're just massaging the scalp, and that seems to take that sense of distraction away. You can have some soreness in the scalp when touched. Might have that by the next day that's gone. There's minimal bleeding really during it because we use the finest, tiniest little needle for the injection. Aftercare is really quite simple. You can shower and shampoo usually that evening. We tell people to avoid hair dye for about 48 hours post. And we recommend combining the PRP with other alternatives. And this is the nutraceutical that I wanted to talk to you about called Viviscal. And what I wanted to mention, you know, I think of these supplements or like Viviscal to be the fertilizer for your, you know, to help the grass grow. And I think of it in that way. There is a professional line that we have here at Aestique, and I do recommend it. It nourishes the hair and helps protect it from the inside with the oral supplement. And then it has a shampoo, conditioner, and elixir to really help the hair on the outside so it's not damaged. What's in Viviscal? That's a really good question. Viviscal helps us revitalize our hair with biotin. It's not a high level of biotin that's actually needed, but it does have a certain amount in it to revitalize the hair. These are critical nutrients to help the follicle grow. There is other apple extract, and that is to repair the hair. It helps the free radicals and inflammation to grow, increase hair density and diameter. The major researched component in this Viviscal actually was designed in from the Inuits that noticed the essential nutrient called amino mar in this. It's critical to help the follicle regrow. They wondered why the Inuits had longer, thicker, kind of coarser hair, and that's how they discovered this amino mar complex in Viviscal.
And a question, Marianne, just looking at the amino mar being a marine complex, if somebody has an allergy to fish, would this be a contraindication for them to use this product?
If they really have a true allergy to fish or shellfish, we wouldn't recommend Viviscal for them. Would have a other combination that could be done, like using minoxidil or Rogaine as a topical would be helpful. So I just wanted to point out the research. There's actually more than 9 clinical trials that have been done with Viviscal, and some of the they're double-blind, random controlled, and there is a professional line that we have at Aestique versus the over-the-counter line. And the difference is really the amount of amino mar that's contained in them. So that really made a difference where Viviscal Professional, you see almost 60% increase in terminal hairs after 3 months. That got even better, 80% increase at 6 months. And then actually a change in the hair diameter after 6 months as well, whereas the extra strength or the over-the-counter, it's not as much research, does not give as much side-by-side comparison, better results like the professional. So that's the one that I would recommend. This is actually showing some of the, if you look in the picture on the right, some of the clinical study that was done showing of an area, both in terms of the top hair picture of a square section of hair, what that looked like at baseline, and then after 3 months, the typical kind of hair growth that was seen in the middle. And then actually, like I said, taking it longer actually produced much more hair, increased number of hairs, and actually thickening of the hairs that are there. So it has been quite studied. How do we take Viviscal, the supplements? Well, the dose is 1 tablet twice a day, and we do recommend it for a full 6 months because of the study and research. So most people do see a difference within 2 to 4, while the best is to consistently use it for the full 6 months. And you can use it in conjunction with minoxidil over the counter or and we do recommend it definitely with PRP. Or if you happen to be using the other supplements like finasteride that we talked about earlier with one of the questions.
We do have another question that came in, and she's asking about the red light therapy. So the helmet that's newer out on the market for hair stimulation.
Okay, I can tell you that there are research about the helmet and in using it consistently, meaning the helmet using consistent, they usually recommend 2 to 3 times a week for about 20 minutes wearing that helmet. I do have a helmet. The problem with a helmet is I forget to use it, and so I have it on here and I just, because of my busy lifestyle, I forget to use it. So, and I can tell you that it might maintain the hair, but it doesn't have as much stimulation of the hair as PRP. But that's a good question, and some people it does work if they're consistent about doing it. I went ahead and I looked up different postings for PRP for hair loss, and I just thought this was a dramatic one, even after one treatment of PRP. But then look how there's a time that you need that to work. So that picture, while they might have had one treatment, that photo wasn't done for 2 months after that. Just some other pictures, again, of females, showing some before and afters, and how we see that in females is the widening part. And so that has made a dramatic difference in these individuals. Just some more like before and afters that I thought were quite impressive of the power of PRP for hair loss. What is a true believer? And that is like the power of PRP. This is real life. This is PRP before and after on my husband. So I actually did 4 treatments on him, and this picture on the right is 1 month after the 4th PRP treatment. And he had an amazing result.
It is a beautiful result. Looks very, very good.
Yeah, each picture was taken right after he had his haircut.
So I want to go over the special offer for the webinar attendees today. And thank you, Marianne, for all of that great information. It was chock full of interesting education. Yeah. I definitely found very beneficial, and I hope you all did as well. So we have 2 great packages that we're offering to webinar attendees. The first package is 3 sessions of the PRP Hair Restoration, and that price is at $1,550. So the value of that is just shy of $2,000, so you're getting a very good savings on that. And the second package will include those 3 sessions and the Viviscal products. So you will get the shampoo, conditioner, elixir, and the 90-day supply of the supplements. And that one would be for $1,762. Now, how you can order these, it's very easy. We have this wonderful Shopify account that we have set up, and you will be getting an email with a link to watch this again, and also a link to click on our shopping account. And you can go right on there and you can purchase either one of them. Some people were asking, could they purchase 2? Yes, you definitely can if you'd like to. You can also email us at info@aestique.com if you have questions. We would be happy to answer those for you. We really want to make another date with you. Marianne is wonderful, and she's been doing PRP hair restoration for a little over 6 years, so you're in very good hands with her. We're doing virtual or office consults, and they are complimentary. So you can email info@aestique.com, and that'll come to me, and I would be happy to help get you set up with Marianne to start your journey. A couple reminders we want to give you. We have our plastic surgeons that spill all of their secrets every Tuesday. So they're going to be coming up on Tuesday, May the 2nd at 1 p.m. talking about mommy makeovers. It's something that you definitely don't want to miss. And after that webinar on Tuesday, we will be switching times just because everybody is starting to go back to work. That we'll be doing Thursdays at 7 p.m. and then have our recordings for you as well. And on the spa side, our next episode of Spilling Secrets from the Spa Aestique, we're going to be talking about Aestique Elite VIP memberships. We have wonderful membership programs that you can take advantage of. We just recently improved them, so there's so much great stuff for perks and benefits for people who are even members now or non-members. So stay tuned for that. We will be releasing that at 1 p.m. on Thursday, May the 14th. Really excited everybody joined us today. I don't see that we have any other questions, so I will turn it over to you, Marianne, if you'd like to say something and close.
Thank you very much for attending this presentation, and I look forward to treating you and helping and meeting you in person.
Thank you all so much for watching, and please remember, follow us on social media. We have our Facebook and Instagram channels. We also have YouTube, which is Aestique Medical, where we upload all of these great webinars and have lots of do-it-yourself treatments and other great things that the plastic surgeons have put together for all of us to enjoy and learn. So thank you for joining us. Until next time, we hope we help you live life counterclockwise.